Hello and welcome to 5 Minute Pharmacology. Today we're going to be talking about the drug Lorazepam. Lorazepam's trade name is Ativan. It's classified as a benzodiazepine or anxiolytic. It's carried 2 milligrams in 1 ml vials, and we currently stock 4 vials of this medication in our drug box. The pharmacology and action of how Ativan works is it is benzodiazepine that functions as a CNS suppressant, anticonvulsant, and a sedative. So the way that benzodiazepines work is they work on the neurotransmitters in your brain, the neurotransmitter GABA specifically in the brain. And when benzos bind to these receptors, it suppresses CNS activity by allowing an influx of chloride, which is predominantly negative, into the cell. Therefore, numbing the cell, making it harder to excite, harder to depolarize, and that's how, and less excitable in essence. So that's how these benzodiazepines work to suppress that um, uh, neurologic function. Um, Now, some times we would give Ativan is for seizures. We would give this for sedation. We'd give Ativan for agitation and excited delirium, and then uncontrolled shivering and hyperthermia. There is one more time we actually give this, and if it's on the protocols in which we give it below, and we can give this for patients who we elect to do electrical pacing on, because that can be um, a little bit of an uncomfortable procedure when we're pacing patients, and so we can give Ativan in that case as well. So some absolute contraindications for Ativan is neurological respiratory depression, and because it is a CNS suppression, we don't want to give something that's going to depress them even further. Acute angle glaucoma and an allergy. So some side effects of this is obviously respiratory depression and hypertension can occur. So we need to make sure we're keeping an eye on the patient. We do have to assist ventilations. We need to be ready to do so. And so please make sure you're monitoring those patients with end-tidal CO2 anytime you give these medications, um, especially benzodiazepines. So and it's most likely to produce respiratory depression when we have other co-ingestions like alcohol, barbiturates, even other benzos, any other type of depressant. And so, and then for the elderly patients, they may have more of a profound effect, and we should try to limit the dose to half doses if they're over 60 years old. So IV administration, the onset is quick, 1 to 2 minutes when given IV. Peak effect is less than 15 minutes, and its duration is 6 to 8 hours. For IM administration, the reason why that Ativan is not really, there's better options to give. Let's say a patient seizing, there are better options to give intramuscular injections to. Ativan is oil based, and when you look at an Ativan vial and you tip the vial over to its side, you will see that the fluid is pretty viscous. It looks like almost like clear olive oil in the vial itself, and so it takes a while when given IM for that medication to absorb. And as shown here on the protocol, even 15 to 30 minutes it takes for its onset, and the peak effect is within 2 to 3 hours. So its duration is the same at 6 to 8 hours. So when we're talking about giving this medication, especially for seizures, maybe Versed IM is a better choice. However, if you do have an IV established, you can opt to choose Ativan. So some other protocols that it's listed in here is agitated or violent patients, so behavioral emergencies. You can give 2 to 4 milligrams IM or 2 milligrams IVIO. You can repeat it once after 15 minutes to a max of 4 milligrams. You can give this for pacing or bradycardic patients who are electing to pace for pharmacological management at 1 milligram IVIO. You can repeat this 5 to 10 minutes to a max of 4 milligrams. If the patient is over 60, you would reduce that in half. So you would give zero point 0.5 milligrams IVIO. Repeat that 5 to 10 minutes. So seizures, you would give zero point 0.1 milligram per kilogram IVIO slowly over 2 minutes. The max single dose is 4 milligrams. And you have a 2 dose max. RSI greater than 15 years old. It's a post paradox or post. That's on the backside of our RSI cheat sheets for post innovation sedation there, and it's zero point 0.1 milligrams per kilogram IVIO to a max of 2. And you may repeat as needed. So um, I hope you learned a little bit about Ativan and benzodiazepines as a whole. But I appreciate your time. Make sure you smash that like and subscribe button.